This is Mark Manhart of the calcium therapy, and we're going to talk about something that's pretty special right presently in our series Dentistry 2020. Let's talk a little about COVID-19 that's hitting the world. Just to start out quickly, where in the world am I from? Uh, I've been practicing dentistry about 58 years. I was in the service in the Air Force, had a wonderful time learning dentistry then. Then I've lived in Omaha the rest of my life. And about the virus, let's talk about environmentalizing. We call it self quarantine, like we're in jail. It feels that way sometimes. But environmentalizing is what we've been doing in the calcium therapy work all of this time, but we never thought of it that way. I found a better word for describing it for me, and it's coalescence. Consilience. No, con consilience. There are too many of these hard words in dental science. And consilience. Consilience is we know some things, and that's what we're living with. And then every once in a while, something comes along, and it's pretty good too. And consilience means how do we put these two together in such a way that we get out of it is bigger than either one of it. So that's why I like to use that word. We have something. How do we use it? That word is repurposing. We've been repurposing environmental things to practice dentistry better. And so years and years ago, we came across the calcium materials that enabled us to do this in dentistry. We knew how to use it inside the tooth. Okay, well, we started using it in root canals. So we designed a non-surgical root canal therapy. And then we used a little more and a little more things. And very soon we learned how to use it in periodontal disease, which happens to be one of the most treacherous diseases that is all over the world. And we learned how to use it. And in the result is we have eliminated periodontal disease from our practice of using these calcium materials. Now, not many people in the world have learned that, sorry to say, but we've learned that anaerobic bacteria that cannot tolerate oxygen, they can't live very well in the human body. They're great for animals, they're great for earth and plants, but for humans, anaerobic bacteria is not good. Well, there are two places in which anaerobic bacteria can colonize, and only two, just in the normal person. In the mouth where we're breathing oxygen, yes. In the lower gut where there's hardly any oxygen at all. So these get into our system from animals or from all kinds of things, and they colonize there, and we find them in the mouth to be very terrible. They will destroy teeth, literally, right through the tooth. They will destroy the tooth, and they'll destroy the whole mouth, especially if you have a mouth that's terribly full of bacteria a lot. There are other kinds of bacteria that are not good. Most of them are. Okay, so we've learned that, and we've gone so far as to set up a protocol where you have the calcium method of osteoendocystic therapy, bony osteo, endo, root canal, cystic, abscess. And we've learned a whole protocol of how to solve that, and it has worked wonders. I want to read you what the properties are of these materials, so you get an idea of the vast area these materials cover. They are antibacterial, anti-inflammatory, alkaline, antiseptic, antipyretic, which takes the heat out of the sore or whatever it is, analgesic, which takes pain out, and these materials give off free calcium and free zinc ions like crazy. And there's other little thing in there like magnesium, and it's all wrapped up in a timed release package that dissolves slowly. Remember that, dissolves slowly. Timed release. So we can take a patient and treat them for periodontal disease, and we can treat them and keep their environment of their mouth for days and for weeks and for months. We have kept people on this kind of environmental level for 8 years, 9 years, 6 years. Yeah. And wonderful things happen in the mouth that keep it healthy. Okay. Another thing that it taught me was these calcium materials can be used for diastemic, not diastemic, diagnostic tools. They are diagnostic tools. In other words, if you put these materials into the tissue of a healthy person, nothing happens. It just sits there. It just sits there and be healthy. If you put it into what appears to be an inflammatory situation in the gums, it bleeds. It bleeds. Yes, it bleeds for about 5 seconds. And by that time, the material is no longer a paste, it's a solid. It has hardened. And so in its paste form, it is very chemically active. And it bleeds. You get a lot of blood in the area, just like a wound. If you put it in the mouth, in the gums, and nothing happens, that tells us that it is healthy. Now, why is that important? It's important because if I make a diagnosis on a case of any kind, and I do not consider the effects of calcium therapy in that mouth, if I don't consider that in my diagnosis, I'm right only about 50% of the time. Put the other way, I'm wrong about 50% of the time, and that is something I do not want to accept. Would you? No. And that becomes a very important matter when you're diagnosing periodontal disease or almost anything. You can't get away with 50% of something working. And so what we've used is a calcium material that has been repurposed in a lot of ways. Now, if you're talking about bacteria, that's one thing. If you're talking about a virus, it's a different thing. But it is not entirely different. These two guys, they like to work together on a person. You know, they depend a lot on each other. If you have a kind of sick person and they pick up a virus, it's just even worse. And that's what I'm being told all the time. If you get sick, Manhart, you're going to get this virus. And that is a fact. And it is terrible. So If we can find some way to break this down and get the vascular system of the body working much more efficiently, faster, stronger, then in the lung, and I mean that in the lung tissue, then we can reduce the replication of bacteria. Let's see if we can reduce the replication of the virus. We're treating people with oxygen. Oxygen, you got to, well, that's smarter than heck. Uh, you don't live very long without that oxygen. And that's extremely important. Well, it may work out that in this particular area of the body, like the lungs, these materials could be a way to stimulate the activity that is very natural to the body, using calcium more efficiently in the body. And so repurposing is kind of like reoxidation, or it's like re-environmentalizing it and doing it for a long period of time. How fast and how long? We can treat a person's entire mouth in 32 seconds. And that the effects of that will stay in the mouth for 7 to 10 days. And we have other calcium materials that can be used at home, and they can use them every day, 3, 4 times a day, and keep that level of oxidized tissue of the lungs. Of the mouth, we're absolutely sure. Maybe not the lungs, but I'd sure like to see what would happen. Because we have cases where we get the mouth all healthy and everything and get rid of the bacteria, getting rid of the periodontal disease, and patients say, boy, I feel good all over. Yeah, just one example, which says everything to me, that it's connected to oxygen. Physician comes in, sits down, has our treatment at 32 seconds. He goes, well, he gets up out of the chair. Oh, that feels pretty good. It's like a buzz, and I said, doctor, would you explain that in a little more medical terms? And he looks at me and goes, you dumb dentist. And that's true, because I should have known. He says it's the oxygen being sucked it by through the blood. The blood is bringing the oxygen to here, and it feels like it's a buzzing. It feels like it's happening right there where you put it. Yeah. If we could do the slightest improvement, the slightest thing, very easily, very quickly, cost efficient like crazy, and we did it, and the patient just felt better. Just, oh, if they ever start saying something like, oh, I can feel better, oh, I can breathe, we're doing something important to fight off this infection of the virus. Thanks very much for coming and taking your time. Mark Manhart with the calcium therapy. Join us again sometime.